Technology in Focus, highlighting the amazing research and technology that are open to investors. Learn about it here at the UNT Murphy Center for Entrepreneurship and Innovation.
My name's Doug Root. I'm a faculty in the Department of Biological Sciences at University of North Texas, emphasizing in the Division of Biochemistry and Molecular Biology. I've been working on muscle and the proteins that are involved in the contraction of muscle. I've been working on muscle pretty much since I graduated from college at various levels. I was working as a research technician on muscle. I went to graduate school where I received a PhD in molecular biology at UCLA, studying the proteins involved in muscle contraction. And I worked at UT Austin as postdoctoral researcher, again, looking at the details of the proteins involved in the architecture and function of muscle, and continued along those research lines here at the University of North Texas. Two of the major forms of cardiomyopathies include the hypertrophic cardiomyopathies, which people can inherit a genetic defect that causes their contractile proteins to contract more than they should, and this becomes a problem for the heart. The heart tends to remodel itself and sometimes can go into cardiac arrest. It's actually one of, if not the most common cause of sudden cardiac arrest in young adults, like a number of athletes in particular, sudden cardiac arrest events while they're playing in a sport. But it can happen at other times, amusement park, and often a complicating factor later on in life for people who have it. Affect their response to other forms of heart disease, for instance. Then the other major type of cardiomyopathy, dilated cardiomyopathies, in which case, in some of these, people inherit genetic defect that causes their muscle proteins to not contract as much. This also results in a changing of the structure of the heart in response to that, and can lead to heart failure, chronic obstructive heart failure, among others. In designing small peptides that can bind to targeted regions of the proteins in muscle to modulate the ability of the muscle to contract, either making it contract more or making it contract less. And especially recently, we've been targeting the muscle that is involved in making the heart beat. And so the peptides we've been working on, we've been characterizing them, optimizing them so that they can bind to specific regions of the key proteins in the heart muscle and allow them to either perform better, making the heart contract more, or causing them to be less active and thus having the heart not contract so much. Modulating the output of the heart affects things like blood pressure, and so many very common cardiovascular types of diseases could potentially be impacted by these types of peptides. There are lots of different forms of heart diseases with many different types of treatments. Perhaps the ones that are most likely to be impacted by these peptides are the cardiomyopathies that I've mentioned, the hypertrophic cardiomyopathies. The therapies that are out there are mostly for dealing with symptoms, and there are certainly no cures. The closest thing to a cure, I guess, would be a heart transplant, but that would be, in many cases, worse than disease. Another option are things like beta blockers that are commonly used for therapies, but those aren't ideally designed to treat the specific defects that are found in these diseases. There are some small molecule drugs that are currently in clinical trials, trying to be the first types of drugs to more specifically address these types of diseases. They're showing some promise. Those small molecules target a different part of the proteins that we've been looking at, and we think that the peptides that we're designing, which aren't small molecules, but they're more at a type of very small protein, can have the advantage that we can target them better for specific interactions, and also they have the ability to be expressed, so they can be used in conjunction with things like gene therapies, the types of technologies that are used in the recent COVID-19 vaccines, like mRNA transfer. These proteins could be coded into mRNA and injected and thus delivered to cells and have them expressed in them rather than taking a pill all the time, or transferred more like the Johnson & Johnson types of vaccines which are using adenovirus delivery systems, although it wouldn't have to be quite that complex for these peptides because they're very small. So it's actually, in some ways, a little bit more easier delivery system than for some of the vaccines we're seeing coming out these days. But a little bit more complicated in that you want to target it specifically to one tissue. In the case of the cardiomyopathies, the heart tissue. So far for this research, we've had some pilot funding to help support it. We had a pilot grant with one of my collaborators at the University of Kentucky School of Medicine, where we've been preparing the peptides, sending them to him, and he's been injecting them into mice and measuring physiological responses. We've also had recently funded a grant from the National Institutes of Health, where we're working on studies that overlap with this type of development, but not completely funding the amount of development that needs to be done with them. And I've been in talk with biotech companies, Sarepta, among others, made presentations for them, and we're still trying to get it to the point that they would like to invest in more thorough development for specifically drug development of these types of peptides. We've also worked with the UNT administration. UNT submitted a patent application on the peptides, and so we're hopeful this will all help in the developmental process, and that maybe these will have a positive social benefit down the line.